Stephanie Shea, and I am a freshman nursing student at the University of Michigan. In this video, I will present a patient I have assessed. Patient is a 20-year-old female who is a full-time student. Patient recently had an asthma attack while riding her horse and fell off, hurting her right ankle. Patient went to the emergency room immediately following her fall. The ankle was wrapped and instructions for limited exercise was given. Patient's asthma was treated with an inhaler on site of the fall. Patient's pain at the time of the fall was a 7 out of 10, however, patient is currently in no pain. Patient states that the pain was sharp and limited her mobility. Aggravating factors of the pain was walking, while relieving factors of the pain was putting less pressure on the right leg. Treatment for the pain was Advil. Patient took 2 milligrams tablets of Advil every 5 hours for 3 days until the pain diminished. Past medical history: iron deficiency and asthma. Asthma was diagnosed at age 11. Last asthma attack was 2 weeks ago when patient fell off horse. Patient manages her asthma with inhaler. Patient has a Ventolin inhaler. Patient only uses inhaler when having breathing problems. Patient usually takes 1 to 2 puffs of inhaler when dealing with an asthma attack. Patient has only used Ventolin inhaler since diagnosis and has not changed treatment. Patient's asthma is triggered by vigorous activity and is relieved by inhaler. Patient has no other breathing problems. Patient has no other illnesses and has not been hospitalized before. Vaccinations. Patient received flu vaccination in October 2016. All other general vaccinations are up to date. Allergies. Patient denies any allergies to medication or food. Patient's only allergy is to cats. Patient is not allergic to latex. Patient has no past surgical history. Medication. Patient is not prescribed on any medication. Patient only takes pain medication when needed. Patient uses Advil or Motrin as a source of pain medication. 200 milligram tablets 4 times a day when in pain. Asthma medication is Ventolin inhaler. Functional assessment. Patient exercises daily when riding horses. Patient must take a short break when exercising to control asthma. Patient states that she sleeps 6 hours a day, however, says that she is not feeling lethargic or tired. Patient drinks 2 to 3 cups of coffee a day. Patient denies any tobacco use, alcohol use, or drug use. Psychosocial. Patient currently lives with her mother in Grosse Pointe and states that her relationship with her mother is good and that she has many friends for support. Patient is a full-time student at Macomb Community College studying psychology. Patient rates her stress at an 8 out of 10. Coping mechanisms include being with friends, walking her dogs, and riding horses. Patient states past self-esteem problems with body image due to being overweight, however recently denies any self-esteem issues due to recent weight loss. Patient is not religious. Family history. Patient's mother has a history of alcohol abuse. Father has high blood pressure and high cholesterol. Patient's brother also has asthma. Patient's grandfather died from kidney failure. No relatives have been diagnosed with cancer. Given that the patient has asthma, a full respiratory exam was done. Subjective data. Patient currently has no tightness of chest pain, shortness of breath, lightheadedness, or difficulty or pain when breathing. During asthma attacks, patient describes symptoms of dry cough, difficulty breathing, wheezing, rapid breathing, chest tightness, and shortness of breath. Asthma attacks last about 5 minutes after vigorous activities. Patient has not seen an asthma specialist since diagnosis due to the fact that she can manage asthma on her own with her inhaler. Patient states that her asthma does not get in the way of her everyday activities. Patient can walk without a change in breathing patterns. Patient breathes through her nose. Patient also restates that she does not use any tobacco products or smoke. Patient's mother does smoke often inside the house, so patient is at a risk of secondhand smoke. Patient states having no other respiratory problems or infections. Objective data. Patient's chest is symmetrical. There are no injuries or deformities. AP transverse diameter is 1 to 2. Color of the chest is normal and matches rest of the body. Trachea is midline. Expansion posteriorly was smooth and equal bilateral. Tactile fremitus, normal. Diminished when moving down patient's posterior. All breath sounds were heard anteriorly with no abnormal sounds. All breath sounds were heard posteriorly. Wheezes were heard lower portions of both left and right lobes posteriorly. No crackles present. Bronchophony and gophony and whisper pectorally were all normal, no signs of consolidation. It is also important to give a musculoskeletal exam due to the patient's hurt ankle. Subjective data. Patient states no usual joint problems, walking or standing problems, muscle soreness, or stiffness. Patient states that for the past 2 weeks she has experienced problems walking and standing due to the pain in her right foot. Patient's rating of the pain at the time of the fall and 1 week after was an 8 out of 10 for both walking and standing. However, it has diminished and she is no longer in pain. Patient states ankle problems was only due to the recent fall. Patient is usually able to carry out daily activities. However, the patient for the past 2 weeks was unable to ride horses or walk far distances without stopping. Patient states no back or neck pain. Patient has no past muscle trauma or past history of fractures or sprains. Patient denies any bone problems. Patient has a vast history of falls due to the sport of horseback riding. Patient also always wears a helmet when riding but no other protective gear. No other injuries have been a result of her falls. Patient states that no family history of osteoporosis. Objective data. Gait was even and symmetrical with no excessive swaying. There were no signs of scoliosis in the back. TMJ joint. Expected range of motion in protraction, retraction, lateral motion, depression, elevation. There are no signs of inflammation. Crepitus was present, however, in depression. Neck. Symmetrical with no visible abnormal findings. Expected range of motion, extension, flexion, lateral motion, and rotation. No signs of inflammation or crepitus. Muscle strengths in the sternocleidomastoid were equal, 5 out of 5. Shoulders. Symmetrical with no visible abnormal findings. Expected range of motion in flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, and circumduction. No signs of inflammation or crepitus. Muscle strengths were equal in both deltoids, 5 out of 5. Elbows. Symmetrical with no visible abnormal findings. Expected range of motion in flexion, extension, hyperextension, pronation, and supination. No signs of inflammation or crepitus. Muscle strengths were equal in biceps, 5 out of 5. Muscle strengths were equal in triceps, 5 out of 5. Wrists. Symmetrical with no abnormal findings. Expected range of motion in flexion, extension, hyperextension, eversion, inversion, and circumduction. No signs of inflammation or crepitus. Muscle strengths were equal in both wrists with 5 out of 5. Fingers. Symmetrical. No visible abnormal findings. Expected range of motion in flexion, extension, hyperextension, abduction, adduction, opposition. No signs of inflammation or crepitus. Muscle strength, 5 out of 5. Hips. Symmetrical. No visible abnormal findings. Expected range of motion in flexion, extension, hyperextension, abduction, adduction, internal rotation, and external rotation. No signs of inflammation or crepitus. Muscle strengths equal in adductors, 5 out of 5. Muscle strengths equal in abductors, 5 out of 5. Knees. Symmetrical, no visible abnormal findings. Expected range of motion in flexion, extension, and hyperextension. No signs of inflammation or crepitus. Muscle strengths in hamstrings were equal, 5 out of 5. Muscle strengths in quadriceps were 5 out of 5 and also equal. Ankles. There's swelling in the right ankle. No visible findings on the left ankle. Expected range of motion of plantar flex, dorsal flex, inversion, eversion, and circumduction of the left ankle, and reduced range of motion in the right ankle. Left ankle muscle strength, 5 out of 5. Right ankle muscle strength, 4 out of 5. Spine. Symmetrical. No visible abnormal findings. Expected range of motion in flexion, extension, hyperextension, lateral movement, and rotation. No signs of spinal tenderness. It's also midline. If additional exams were need to be done, an exam on the head, eyes, ears, nose, and throat would be conducted. This assessment would be done to check the throat and nose airways. According to a study done by Benjamin Mearows, Ronald Knudsen, and Michael Lebowitz, children's respiratory diseases such as asthma are found to be highly related to obstructed airways as later adults. Another exam that would be done is a neurological exam. Although the patient did not suffer from noticeable brain injuries from the fall 2 weeks ago, she has a past history of many falls and is at risk for many more. A study done by the Journal of Neurological Focus showed that horseback riding is a leading sport of traumatic brain injuries. Due to the many falls, it would be important to assess the patient's mental status to check for any possible brain injuries.